My name is Dr. Rick Seguil.
And action. Hey, Jay, this is Kirk again.
Stress and investment.
And action. Hey everyone, it's Dr. Rick. And Victor had a question about dosing cannabis. But if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. I don't always talk about cannabis, but it's an up-and-coming treatment that has helped with a wide variety of suffering. So the problem is my boomers who have the biggest diseases, baby boomers, that's late 50s, 60s, and 70s, they usually have an apprehension about using medical cannabis. Medical marijuana, weed, whatever you want to call it. A lot of them will try hemp-based products, and I have no problems against the hemp industry, but you just have to be aware that, just like the vitamin industry, you'll have some things on the shelf that are exactly in the pill what's on the label, and then you'll have some things on the shelf that don't even have close to it, and essentially nothing, placebo perhaps. Then you have some things on the shelf with extra stuff, like metals or organophosphates. So you have to be choosy about this stuff. And when you talk about an industry that's watchdogged by the Fed, they have to be batch tested and they have to prove or show a certificate of analysis for each batch. So I think that because the medical cannabis dispensaries or the cultivators are on their guard, they'll probably, just by sheer threat of getting tested, they'll probably have a better chance of quality product in their bottle, in their package, in their vape, in their patch, in their cream, than what you might find over the counter with the hemp industry. Again, nothing against the hemp industry, but if my patients have a deadline, like I have a patient that's, somebody gave her 5 years to live, and I'm thinking, Christ, if that was me, well, I would do the same for me that I do with my patients, but I would highly push. I would sell the car, get a smaller car, get a bike, get a motorcycle, a moped, and then invest in a year of medical cannabis, because I think there's great uses for it. There's anecdotal uses, but as the data rolls out, you'll see more and more things pop up as being statistically significant, and more doctors will get into the field. Right now everybody's apprehensive. Well, my colleagues are apprehensive because theoretically it's still a Scheduled 1 substance. That means it's highly addictive and has no therapeutic value, which is totally bogus, because every state is now allowing medicinal cannabis, and a lot of states will be recreational, especially Illinois soon. And how can it not have a medicinal quality to it? So it puts me in handcuffs, because I'm always being threatened that if anybody from the Fed audits me, I can lose my license. But anyway, so dosing. I have a lot of patients that come to see me just for the certification, and then I'll ask them, what's your top 3 issues? And then we'll establish what the top 3 issues are. This cute 82-year-old man came in and he said, I just want to sleep. He had his wife was taking care of the business. He was just hanging out. But his memory was off, his sleep was terrible, and his pain was bad. So the pain certainly could have been the reason for the sleep, or he just might be so used to sleep like most 70 to 80-year-olds are. But it's so nice, because one of the side effects of medical cannabis, especially if you do more of a THC dominant strain or product, is sleepiness. And that doesn't mean rob sleep. Go to sleep, but rob your dream state, like benzodiazepines, clonazepam, Xanax. They'll put you to sleep, but they will shorten your REM, rapid eye movement. So in effect, you get to sleep, but your brain doesn't sleep. And then when you wake up in the morning, it's like, wow, that's great, but then I'm still sleepy. Same thing with Benadryl. Make you sleep, but it'll make you sleepy in the morning too. So anyway, cannabis, I like, and if you've seen my other video on Dr. Rick tutorial medical marijuana choices, I have this, I still kept it up. This is the New York classification, New York State classification for medical cannabis. They actually did away with strains. Strains are too old-fashioned. Strains are considered sativa and indica. And the old thinking was sativa, which is a narrow leaf type of cannabis. It's supposedly more stimulating because it grows in a harsh environment, and the indica is more relaxing, broader leaf because it grows in a very calm environment. But nowadays, because of everybody trying to make their own blend and trying to push different ratios of THC, THCA, CBD, CBDA, CBG, all these cannabinoids are called. Like there's like 120. There's probably more components than just cannabinoids in the plant, like terpenes, but there's about 120 specific cannabinoids, and that two of them are CBD and THC, which we'll talk about here. And that's the easiest way I can tell you is everybody has to get dialed in. So there isn't one formula. So if you're looking for my cookbook, there isn't a cookbook. It takes me half an hour, like all of you know, to kind of go through the history, go through how much disease you have, because the same dose for a kid will be much higher than a dose for an older person. That's the way it usually works. And a kid or an older person with a lot of medical problems and beaten down over the years, heavy, grumpy attitude, a lot of inflammation. Well, that person will probably need a different formula than somebody else the same age who might have the same diagnosis but not as severe, I guess, and not as comorbid, or doesn't have as many comorbid things like hypertension, cholesterol, old heart attack, a stent, and diabetes. So it really has to be personally designed, and that's why I love integrative medicine, because integrative medicine bases the first visit on a lot of Q&A, questions and answers, to figure out who is this person, what are the likes of this person, where did this person grow up, was this person exposed to chemicals or factory when they were younger, were they always in the soil when they were younger, was there bullying when they were younger, what did the mom eat, what did the mom cook, what did the kid serve, how did the kid grow up to cook his own, or what kind of tastes do we have now, how about the spouse. So there's a lot of things. Did they ever try medical cannabis? There's a lot of things that go into trying to decide how to start with somebody. And the end product is always going to be, we'll dial it in, and usually it starts low and then go up higher every level, kind of like thyroid medicine. If we find somebody has thyroid or underactive thyroid, we'll start with giving that person, balancing them out first, trying to work on the iodine and a couple of antibody things to kind of make this work better. But if it doesn't work, then we start with the lowest possible dose of thyroid supplement, and we wait about 2.5 months, and we go up to the next highest dose, and it's painfully slow. In medical cannabis, it doesn't have to be as slow, because I think you can effectively do a 1 week, 5-day to 7-day trial experiment with a product, as long as there's no other variables. And that's one of my things. Number 5, not too many variables. So I'll put a link to the other video I did. Not too many variables, because if you're experimenting with one product and you want to see if this product helps with sleep, and you haven't tried any, the only time you tried medical cannabis, well, it wasn't medical, but you smoked it in high school, like me, and that got you high, or allergic, like me. So the idea would be, again, we try to limit all the changes, keep the sleep time the same, keep the wake time the same, keep the meal time the same. Take your usual medicines as you would normally do, and then add on a layer of medical cannabis. One of the patients brought this in. This is from ZenLeaf. This is a menu, and it's nice. You can print it up. This is all you get in Illinois. So you actually, after you get your card, all you get is a menu. You look through the menu. Everybody prints up their own menus, and they change all the time. And the patient care advisor will say, the bud tender. I don't think they like to be called bud tenders, because it's not just buds in Illinois. In New York, there is no bud. They don't sell leaf in New York, and I think they're probably going to make a movement to limit the vape until the CDC releases the information on e-cig issues. I just think if you're trying to dial something in, say you have cancer, or you're fighting fibromyalgia or rheumatoid arthritis, you need to dial in the amount of CBD in your system. You can't get that from a leaf. You can smoke every hour and you still can't get the levels in your bloodstream, in theory, as you can with edibles. So there might be some people who think that they can dial in, but unfortunately, when you do the leaf, when you smoke the leaf, you will have about all 400, you'll have 120 cannabinoids and a couple other 100 terpenes and then a couple other constituents all at the same time. So no question you get the CBD and the THC effect, which we have to go with science because that's how doctors do things as far as scientific method for finding and dialing in the right dose instead of just giving you a big old hammer, which is what smoking does. Smoking will, if that's all you have available and that's all you can afford, fine. First page of this is all bud and leaf and shatter and oil and wax. So you can smoke, but I really think that you're getting way too many chemicals. Good chemicals possibly like CBD and THC, CBG, CBN, CBC, THCA. All these things have different properties in them. Kind of like the terpenes. I might as well talk about it now. These are terpenes. Terpenes are components in plants that give you an active smell. And you can smell these things, and hopefully you can read the byproducts here. There's the color coding is pretty cool because limonene, lemon. That's what gives fruit, especially, and certain roots, so certain vegetables, the aroma, like onion. Like the smell of marijuana, the leaf. That's not due to CBD or THC. That's the terpene in the leaf. So when you smell that in a flower, it's going to be potent. And those of you who smoke, don't think that nobody else is going to smell it. Everybody smells it on you. So be careful. That's secondary smoke, especially if you go hug somebody. So this is the terpene list, and there's a lot of them. There's also, so you have to know about what, I'd like to know what the person's doing with their diet, how they're adding terpenes, because this will accelerate, these terpenes will accelerate the cannabis that you're using, the medical cannabis you're using. And what I usually do is, as I mentioned, if you have cancer, fibromyalgia, rheumatoid arthritis, I try to fight inflammation first with maximizing on CBD, cannabidiol. That's just one of the cannabinoids. And CBD stimulates CBD2 receptors. I'm going to leave it at that. There's usually 2 receptors that are in your body. Most of the CB1 receptors are up here and in the nerves. Most of the CB2 receptors are here, the gut, the immune system in the body. Let's just say neck down, CB2, and head up or neck up, CB1. So the cool thing about inflammation fighting is that it usually stays down here, so there's no high. Now some people will have super off balance, and they might even have their own endocannabinoid system on the brink of failure, because we do have our own chemicals in our body. One is anandamide, AEA, and the other is 2-glycerol, 2GL, no, sorry, 2AG, I'm blanking there. So AEA and 2AG are both in the system, and they're made by nerve cells and made by the body, and that tells you exactly why there's supposed to be a receptor in the body for a plant. It's not actually for the plant, the marijuana plant or hemp plant. It's because we make our own endocannabinoids. And when it's called endocannabinoids, it's made by the body, endo. Exocannabinoids or phytocannabinoids are what you get from the plants. Not only, well, phytocannabinoids are from marijuana, but terpenes are from not the body, but from the plant, phyto. So having said that, you should know that if your own endocannabinoid system is off, and I have another video I just did, I don't remember what it was called, but I talked about the endocannabinoid system. Oh, it's Power of the Plant, the lecture I gave at the Hyatt in Schaumburg. It's a long lecture, but I talk about the power of the plant somewhere and the endocannabinoid system. I will put the link and a shortcut to where I talk about the ECS. So if your ECS, which is essentially, I call it, there's several different systems in your body. I don't mean to go off track, but it helps with figuring out your ratio. Several different systems. One's a parasympathetic, relax, eat, have sex, sleep. And then one's a sympathetic, fight or flight. And then one's the endocannabinoid system. So the two systems, parasympathetic and sympathetic, are on, and they usually oppose each other. It depends what time of the day, what you're doing. But on top of them will be the endocannabinoid system that modulates them and tells them to work right. It keeps everything in a homeostasis, balance. So usually if life is off balance, the endocannabinoid system, your own endocannabinoids, will kick in, make you feel good, especially if you're meditating or you have some form of good sleep. and you eat properly, you'll have an endocannabinoid system that works properly. I like to think of the endocannabinoid system as corporate. I work for Advocate, and we have our front desk business, we have our back office just clinical, and then we work separately, but at the same time together. Well, corporate comes in and just makes sure that we're always working together and everything's smooth and we're getting paid and patients are going in and out and all this other stuff. So that's what the endocannabinoid system does. But if it has been trying to regulate the other two systems for 10 years, 20 years, and you're not able to fix anything, it'll burn out. So that maybe, as I was getting to before, maybe when you go for the CBD, that doesn't go into the brain. The CBD, in very concrete terms, is not supposed to be psychogenic. Now, I have some doctors, and I do believe there is psychogenic activity, but altogether, on the whole, CBD stays chin down. You just think of it that way. So there are some people, though, that if their ECS system is totally off, they will feel the effects of being happy again because the system, the pain is gone. When the pain's gone, you might get this elation. You're not going to get high, but you might get elation. Or if you're off and you're anxious, you might get a little more anxious. Possibilities are there, but again, it's a modulator. It doesn't worsen. It's not a receptor blocker. It's not a receptor agonist. It modulates, so it's supposed to help things. So I think that if you can get a decent amount of CBD in your system with products, and I usually say the easiest way to do it is not by smoking the hammer or vaping the hammer. Now, when you vape, it's a little more fine-tuned than smoking the whole flower or all the leaves. So when you smoke and you have a lot of cannabinoids get into your system all at once, there's a fast rise and then there's a fast fall. So you have to hit again. And you constantly have to hit. And I have a patient who asked me about doing high THC doses for her cancer 6 times a day, and I thought that I haven't read that protocol. I don't know that protocol, but Mara Gordon, who owns Aunt Zelda's, has been doing this for a long time. I like her protocols, but you have to go see her in California. However, I haven't heard of that protocol, but I guarantee you one thing: if it does work to calm down the cancer, I don't remember which cancer she has, but say it's a glioblastoma multiforme. That's a fast-growing, multi-shifting, shaping cancer, but hitting it with a cannabinoid all the time will probably make it succumb. There are things like ID1, it's a gene that the CBD does, or medical cannabis does, downregulate, so that at least in the case of breast cancer, you don't have metastasis as much. So there are studies that they're rolling out of the United States, and there is definitely benefit for it. So we just have to, as doctors, know how to dose, and I'm getting to that soon. But spoiler alert: there is no dosing strategy. I should say there's no exact dose. So everybody thinks, oh, I need antibiotics. So I have a little kid. I'll give 5 or 7.5 milligrams per kilogram. Figure out what the kilogram dose of the weight is. Divide that into twice a day, spread it out over 7 days, and that's the dose in the bottle. That's easy. Chemotherapy, you know what kind of cancer you have. You use the protocols that have been established. You give it this many times. That's kind of easy. It's cookbook. But medical cannabis is different because it's biphasic. So at low doses, it works pretty good. And then suddenly at high dose, it doesn't work that well. But at a super high dose, it will work again, which totally doesn't make sense. That's the beauty of the plant. The plant can be used. That's why different strains are being created, gene modified, to produce different effects. These cultivators are great. They're doing what they have to do to provide different products for everybody, because it's not just one product. Everybody needs a little bit different thing, and everybody has to get dialed differently. So again, if it's an inflammatory issue, I would start with CBD mostly. I would do it 2 to 3 times a day. This one place, I like also Verilife. They're in Arlington Heights, but I don't have a menu at this point in time. You can probably go on Leafly and figure out the menu, but I like to see the menu with everything in front of me so I can compare. Sometimes when you have to scroll down the online menu, it's like, what was that one? What was this one? Go back up. It's a little confusing. So I like to see them all at once. So in this case, if you talk about capsules, here's all the capsules. Here's the price somewhere. Here's the price. That's the capsules. There's a little bit of the constituents, THC and CBD. So you can see that in this case, I'll specifically say, for my guys with inflammation, this has been the best. Mary's Remedy Oil. Look at this. It has like 500 milligrams of CBD. That's absurd. 500 milligrams of CBD, but it is expensive. However, a small amount will go a long way, and only, 25 milligrams of THC. So even though it says 25 per, it's probably per dropper, that's a tincture. That's a tincture. So it'll go a long way. I mean, you don't need 500 milligrams of CBD, but you have the option. Again, it's a biphasic curve, so a low dose should help. A higher dose will probably not help, but a super high dose will probably help again. So everybody's a little different. The higher you go, the more you get into that hammer effect. Like when you smoke a whole flower, you get everything all at once. In the midst of having all the reactions that the flower is giving you, you probably have a nausea effect, a sleep effect, and maybe an immune system effect, but you'll be so side affected by the high part that it'll be disruptive to normal life. That's why I was thinking with my other patient, I'm not sure how she's going to do 6 times a day, 4 times a day, without going to sleep and just watching movies like Cheech and Chong or eating. So those are side effects, but those are side effects because you use a big hammer. I like to fine tune what's called microdosing. It's not really like you're microscopically dosing anything, it's just small doses. So the cool thing about, and this is, I have to give Robert a thumbs up because Robert gave me a great idea. And I have talked about diet or cannabis journaling, and I have another video on that, but this is from Verilife. This is pretty cool. Cannabis, what's it called? Cannabis Chronology. That's pretty cool. So Verilife in Arlington Heights, give the talk. They sponsor the talk at the Hyatt. So what I said, you always have to keep a diary. And Robert said, because I said, those things, those labels rub off and you're not going to remember. So keep a diary, write it down. Robert said, just take the sticker off. I said, wow, that's a great idea. So these are the stickers to previous things that my patient had tried. And I put down side effects, I put down the date. Because these things will change. So these stickers are super hard to read. It's tiny, but you'll see CBD somewhere. I summarized it down here. And I put the date. Why did I put the date? Because if the patient I'm taking care of buys it in the spring and then tries to buy it again in the fall, the product will be slightly different. So because the plant changes. Even when you have batches, when you say you harvest all the plants, just like hemp, when you harvest all the plants from September that grew quick and you do what you have to do to fine tune, get the solvents, all that, to get the product. When you batch test, you have to batch test you have to batch test the stuff you harvested, and you'll probably have about, say, 30 pounds of flour, and then maybe when you batch test, you divide it into batches, say 8 batches. And of the 8 batches, there's not going to be exactly the same chemo profile in the batch, meaning the CBD content, the THC content, or anything in between, CBN, CBG, CBGA, CBT, THCA. So there'll always be a slightly different chemical profile. So it's impossible, compared to antibiotics. Because the FDA regulates antibiotics, there's a specific amount, there's a specific formula, you guarantee to get that much antibiotic in. If you take 2 pills a day, bingo. And that's why even when you go generic, theoretically generic should be the same, but a lot of people that take generic, they know that, most people know that it's not as good because the quality is not as good as the good stuff. That's why some people insist on going trade name instead of generic. Well, think of cannabis as always like a generic shopping list. You have to think that your quality might change, and if you don't take down what you bought back, what you knew that you were using back in the spring when the disease was under control and all the blood tests and the x-rays and the MRIs look great. If you don't remember, you're going to have to experiment all over again, and that experiment can take up to 2 weeks of a lot of money. When in actuality, you just go back to your cannabis journal and you say, okay, I did this way back in the spring, I'm going to do it again. Because spring will come around again, and you're going to forget, did I do this or did I do this? You're on this now, but it's gone because the season's over. So that's why it's nice. So Robert, great idea. Those stickers do come off. You have to use a knife, but they do come off, and I put tape on them. However, that's why it's important to know if you're self-medicating because nobody else is helping you, at least get the patient care advisors to help you. But with my knowledge base and a lot of the experts out there, I think that it would be wise if you do have a disease to get professional help. You can go by the anecdotal stories in the dispensary and kind of get your way, but remember, it's not, you have to set out your top 3 goals. And if you know what your top 3 goals are, then at least you'll always be focused on that. If the top 3 goal changes, that's fine. If sleep was the primary goal and pain was the second, but then you got a pain flare up the next time you went to the dispensary, I can still shift up and down a little bit, but you should still keep them. It's like my fibromyalgia patients, they have rotating pain, they have jumping pain, they have the migrating pain, they have a whole bunch of symptoms, they're super sensitive. So if you don't keep track of your top 3, you'll be adding another 3 and another 3 and another 3, you won't get anywhere. Because you'll start the dialing process of mostly CBD for an inflammatory process, and then for say a trigger point, and then you do 5 to 7 days, and then suddenly something else comes up like nausea, so you got to take care of that, and your trigger point's backstage. And you do something else, and you keep on buying new products because different ratios and different products will help different symptoms. I think different cannabinoids have been on a like a 30,000 foot view. Different cannabinoids can help with different things. I think if you have those inflammatory things, cancer, rheumatoid arthritis, fibromyalgia, lupus, Sjogren's, anything autoimmune, Hashimoto's, you should work on building up a CBD level. I do 2 to 3 times a day, and I would start lowest possible dose. So as I mentioned in this thing, you can get tablets. I think the better way to control it is edibles too. Concentrates, I would do tinctures and tablets, gummies, or candies. So that's how you build up a level. Over the course of time, when you take vitamin D, take vitamin D every day. Sometimes when your vitamin D is checked, even though you're taking the same pill that says on the label 5,000 international units, when you get your blood test check, I say, you're not there yet, but we're getting there, so double your dose. 10,000 a day, holy mackerel, that's a lot. Well, look at your blood test, nothing's getting in. So you increase the dose, and then you wait, keep on with that. No other changes, no extra sunlight, just keep on with that dose till the next time we check, 3 to 6 months later. Hey, how's your level? Okay, what are you taking? Still taking the same thing? Cool. It's good, or it's not good. Double it again. What? You mean 40,000? So that's how it works with the vitamins. That's how it works with sometimes antibiotics, vancomycin. That's how it also works with cannabinoids. So you have to keep on increasing dose until you have an effective system response. So it is a little different because you can't really test levels in the bloodstream. That's why I'd say, so like, for example, if you're taking this one, tablet of, this is probably a Vexia Relief, my favorite. That's 2.5 milligrams of CBD and 0.16 milligrams of THC. Hardly anything, but at least you can initiate this. It is $30, so I say do half a pill, 1.25 twice a day to start. And it doesn't sound like much, and it isn't much. The younger you are, the more you'll need. The older you are, that might be good enough. So you get that CBD in you, and you keep on building it. You keep on building it. Well, you want to make sure during our test that there's no side effects for after 7 days. If you're doing twice a day, it's cool. Great. Add on after that, or just wait. Continue that one. Don't change any dosing, and then go on to your next project on top of the CBD. And we're essentially looking for side effects. So that's what I would do. I would say it depends on how diseased you are. It depends on if you've used medical cannabis before. If you haven't used, there is a word of caution. the higher you go towards the THC, because if you have anxiety, PTSD, sleep discomfort, just chronic pain, you'll have to put THC in there somewhere. I would probably do the tincture, the gummy, or the candy, or something oral for the THC, because I think it's easier to dial in. I am apprehensive about I used to like telling people vape because it's fast and it's limited as far as not 120 different cannabinoids, just like 2. But that e-cig scare I want it solved first by the CDC before I make more suggestions. Flower, if that's all you can afford, that's fine, good luck, but you're going to be high all day. Or maybe you'll find a high a sativa that you can just get enough of, but again, the blood levels of what you inhale go up high and then they go down low because they do have to pass eventually through the liver. They go through the lung, into the bloodstream, into the receptor, and then great, but it gets to the liver and then destroyed. So like Xanax, fast in, fast out. So that's why I think there's an addictive quality with it. With smoke, if you want to try to develop good levels, fine, frequent dosing, but you could be asking for trouble. Be careful. When you can afford, or when you sell your car and get a moped, then I'd go for the orals as best as possible. And in this case, if it's cheaper to buy hemp-based orals, that's fine. Some of the best quality hemp products, hemp is mostly just CBD and 0.3 or is it percent THC, so it's negligible. But I would still say you might turn positive if you're a DOT driver. So if you wanted to go from medical cannabis and use hemp too, that's probably okay, but I would always go for this because of the reason I gave earlier as far as the monitoring and the quality assurance. So that is how I would base it. I think you should always learn. Luckily, there's a lot of information being released on medical cannabis, great books that you can read from on medical cannabis that will give you some ideas about the flower. There's so many different hybrids now. And they're all weird names. So this is just one of them. There's a really weird bubblegum type, Harlequin, Gorilla Glue. There's weird names, and that's fine, but they have different properties. So worth it to understand before you go shopping. And Leafly is a good a good source of information too, leafly.com. And now the medical community is starting to get into it, but it's mostly with the age medicine docs. And I went to an age medicine conference because they are one of the only ones with cannabinoids, at least cannabis experts. Different type of doc, but they usually are very well dressed. That's number one, and a little bit older, I think most of them, but a little different than integrative medicine docs. But we're all in the same business together. So this is what came from the A4M meeting. Pretty cool. Still learning. Again, Robert, that was cool. So bottom line is that I would start with one experiment at a time. I would try to get in CBD as best as tolerated. Watch the body, the lifestyle, the side effects of dizziness, forgetfulness, or fatigue for the first 5 to 7 days. If no side effects, great. Continue on with that same dose. If you can afford 3 times a day, it's better because CBD orally, after it gets through the liver, usually lasts about 4 to 6 hours. I just said twice a day because it's easy dosing. In my experience from the past, when I give somebody 3 times a day antibiotics versus twice a day antibiotics, usually they'll not take the 3rd dose. So it's better that I would just do twice. The only problem with most CBD products is that they only last in the system for about 6 hours. But hey, listen, if you get enough CBD and you crank it up every couple of months, after proving that you don't have any side effects, and also after adding on a hint of THC, which I usually say take the THC at night, mostly because it does help with sleep, does help with pain receptors and pain interpretation, and also accelerates the morning dose of your CBD so that it'll bump it up a little bit. They're cousins. THC works on the nerve. CBD modulates the place where the THC works. So they both work beautifully. So I think you do better by taking both. That's why the folks that are taking just hemp, I think if you added a little THC, that it would probably work better. I think you're going to see as information rolls out, the data rolls out, that whether it's from Canada or the U.S., there's combinations of THC that help with all people. And that's where So I mentioned about inflammation, CBD building. Well, the other thing that also happens is you lose problems with temperature control. So let's just say traumatic brain injury or cancer. Sometimes you'll have, after chemotherapy, your homeostasis will be off. Your brain will be injured a little bit, and the glial cells won't be able to do what they're supposed to do. So you'll have a little bit of inflammation in the brain. Well, sometimes the nausea center and the eating center is screwed up. So you don't get to eat and you become nauseated all day. Well, they come from an area inside the brain. And in most cases, the THC, when it's used, will calm down that area. That's why the government pays for, in most cases, Marinol, Dronabinol, which is a prescription THC. I think it's Delta 9 THC. And it's supposed to be for wasting syndrome, if you had HIV, or cancer where you are continuing to also waste away or you're continuously vomiting. So THC does have its uses, but most people who have tried, at least as far as I've read, Marinol, Dronabinol, they don't like it because that's only one thing. It's not really that many components. It's too targeted. I think you either had too much of a side effect from the hammer that you smoke, if you smoke flower, and if you go with something that's specifically Delta 9 THC, you might not like the effects of that. So I think there's something in between that you have to kind of put together and blend. And again, everybody's a little different. The bottom line is that you have to start with CBD. And some people that come in to see me, if I hear nothing but anxiety, panic, and can't sleep, I'll tell them, start with your THC first. Take this gummy, take this tincture that's high in THC, do it for about 5 to 7 nights, see how you feel. If you have no problems, do it every single night and then add on the CBD 2 to 3 times a day. And then maybe you can titrate down your THC as you titrate up your CBD. It always takes give and take. So I usually have to tell patients, portal me on the patient portal and let me know how things are going. I can make the next suggestion. But I'm feeling that patients should be coming in for face-to-face so I can actually see how their experience is going. The facial expression and then the Q&A, not the whole thing over again, but Q&A helps me figure out what their experience is, how they got received at the dispensary, the advice at the dispensary, and hopefully if they bring in their diet diary, their cannabis journal, their cannabis diary, I can go through that too. All of you should get one of those things. That's awesome because it's easier for us as coaches to figure out, okay, where did we go wrong? How do we change our goals, top 3 goals, and which way do we go from here? And don't forget, like I said with the terpenes, it's always important to have something else in your system, healthy food. The 82-year-old guy wasn't willing to give up his 2 glasses of wine every night. He wasn't willing to change his food from, what was he taking? Microwave food, I forget which one, but high in salt and a whole bunch of preservatives. And I said, you know what, you got to have 1 real meal a day because it'll make the CBD and THC work better, which it does. Omega-3 oil helps THC. Probiotics will help, especially if you take edible. And the probiotics, the gut microbiota, will also help your brain if they're also calm, which they do get calm. It supports them, they support you. It's you scratch my back, I scratch yours. So I think there's benefit to eating properly while you're doing this stuff. But as I mentioned, I wouldn't change too many variables. So maybe learn to eat first properly. Learn to try to get the routine down of no naps, decent sleep, wake cycle, eat as best as you can, whole food when you can. So take a supplement if you have to. So that's it in a nutshell. Hopefully it's not too confusing, but number 1, keep a diary. Number 2, have your top 3 goals. Number 3, try to get in, if it's mostly inflammation, your CBD started, and try to make the CBD a 2 to 3 time a day thing for the rest of your life. Number 4, if you do have more of the other issues, anxiety, panic attack, just severe pain, anguish, headaches, migraines, THC is great for migraines, or just sleepless nights, you can do the THC first, but plan on having a little bit of a fatigue, dizzy, or forgetful morning, because some people will overdose. I'd go as small as possible at night. Say, if you're taking a gummy or taking a tincture, quarter of a tincture, because I can tell you milligram dose, but that's, again, milligram per kilo dosing, there's no schedule like that because everybody's different. And it all depends on the plant. It all depends on the type of season. It all depends on what else you're eating. So I would do, just so it's easy to measure, half a dropper of the tincture or a quarter of a gummy every night for about one or the other, not both. Every night for about 5 to 7 nights, and you watch the effects. No effects, crank up the dose. Another 5 to 7 nights. No effects, crank it up again. Now you might spend a lot of money, but if you start out low and you have the effect, stop. Just hold at that and you should be fine. You'll be at the first phase of the biphasic waves when you don't have to increase because you'll lose. At the highest consumption rate, you'll lose the effectiveness. But until you push over to a very high consumption rate and spend a ton of money, then you'll get the effectiveness again with probably a lot of side effects. So I want people treated here so they can save money in the long run. Sometimes cancer has to be treated and bombarded day after day, twice a day, 3 times a day for a couple months to see an effect. I have a patient that's he's getting a biopsy for his prostate cancer in December. And he was asking me about the fasting mimicking diet, and I think it will work, but you need 3 cycles, so it might not work by the time biopsy comes. But it's okay, just get the biopsy anyway, and if you go at the other end in January and you're feeling good with either the diet change or you introducing medical cannabis, then we're on to something good. I would probably, as I mentioned or alluded to before, you have to have some level of measurement. So whether it's a side effect you're looking for or a good effect, those are 2 levels of measurement that I want to hear about when you come back in. I can always get inflammatory markers, I can get a CT scan of the brain, I can get a CT scan of or an MRI, that's what usually an oncologist would do, to better assess, or I get a physical therapist to see if your range of motion is improved, might get a sleep study to compare before and afters to see if you are sleeping deeper, or might get blood tests such as thyroid tests or adrenal tests or ovarian function tests to see if the body's starting to kick in again. When the body likes what you're doing, it'll work better, and I'll see it on the blood test. Even if you don't feel it, I'll see it on the blood test and I'll say continue. And then maybe you will feel it. So there's a couple different ways to do this. However, that's it in a nutshell on what I would do. Everybody's different. Monetary, what you have available is different. Your diseases are different. Even if you have the same disease as somebody else, you might be presenting differently. So that's why it's really important to dial this in personally. So when you go to the dispensary and you just get the advice of the young people, or some of a few older ones, they're probably working on anecdote, unless it's just PTSD, which some young people have, or anxiety. But they're probably working on anecdote and a previous story about maybe how somebody on the internet, on Facebook, got great results, or how one of their patients at the dispensary got great results when they did so-and-so a product. But I like to do science, anecdotes, an N of 1. I like to see studies that show an N of 1,000 to N of 10,000, but we're not there yet. The government's not approving anything as far as studies because, again, it's still Schedule 1. So nobody's going to give you money from the government, NIH, to study a Schedule 1 drug. Maybe if you vote for somebody that gets it off of Schedule 1, that'd be great next year. But until then, you'll just have to work with somebody who's knowledgeable about cannabis and work with the community altogether and hopefully dial yourself in. Hey, one of the things I failed to mention was that this is the thing I was talking about as far as 14 to 1. I've done an unboxing on this, I believe. Hopefully not too, can't see it. There. Vexia Relief 14 to 1. So, in fact, if you're trying to go for pure CBD or mostly CBD, Vexia Relief is 1. And then this one is Matter, that's another one. There's like 250 milligrams of CBD to 16 milligrams of THC. Somewhere over here, but way too bleached out to see it. There you go. Maybe you can see it that way. So that's Matter. That's a Vexia Relief. This is okay. Mary's Drops. This is a concentrate. This is 1 to 1 though. Has equal portions of CBD and THC. And as I mentioned to you, and the reason I wanted to do this afterthought was you can't just say, if you take half a pill of this twice a day, it's 1.25 milligrams of CBD. And if you think about the hit in a couple of these other liquids, but some of them contain up to 10 milligrams of THC. And it might not sound like it's much, but it's a starting point. So the effective dose, milligram per milligram in one person will be maybe not enough, but you got to start somewhere, like my analogy to Synthroid or vitamin D. But you can't just compare 10 milligrams of THC like in Marinol to 1.25 of CBD in this, because of the entourage effect of how when you take this tincture or this tablet or this capsule at night or this tincture twice a day, 3 times a day, actually this is just at night, CBN, but if you do these 2 to 3 times a day on time every single day for the rest of your life, this will have an effect on the way the vape works. This is a typical vape. There's a couple of other vapes in here, but the vape at 10 milligrams per hit probably will be much more effective when you have CBD in your system. And the other thing is, because I said it modulates the way THC works, if you have the munchies or if you have a paranoia from this, the CBD that's already in your system will calm that down, which is cool. The plant takes care of itself, which is unbelievable. And that's why there's an arbitration whether is this recreational or is this medicinal? Is it a medicine or is it just something you take for recreation? Is it over the counter or is it prescription? I mean, if you think about it, cold medicine at a certain dose and for a certain age is over the counter, but if you get and you include a certain dose, go a little higher, you have to go behind the counter, show your ID, because suddenly it's not a prescription, but it's controlled somewhat. So these are the candies. There's the chocolate everybody seems to love. My older women, for some reason, like this one for sleep. Gummies from one dispensary, candy from another dispensary. These are all leftovers. And then topicals too. Topicals, I think you can take advantage of. This is like the one I got in Colorado way back when, a couple years ago. I do not think they're going to hurt. I don't think they really get absorbed. This is cayenne and menthol together. But I think for older people, especially with thin skin and joint pain in the hands, these topicals might make a difference for their life, and that's all they'll need. Maybe something else for sleep, perhaps. But on top of the projects of trying to get the CBD in 2 to 3 times a day for the rest of your life, and then maybe dial in a little THC dose to get your sleep better, get your pain under control, or if you have to, when the CDC clears everything, vape. I think it's a little bit more fine-tuned than the flower, because again, the flower is a hammer. This is a tinier hammer. This is a really, really tiny hammer. The exact dosing. So don't be turned off by the fact you're only doing 1 to 2 milligrams. Sometimes 1 to 2 milligrams with the right balance of the entourage effect from your terpenes, from your foods that you eat, from the meditation you're supposed to do, from the physical therapy, and the happiness you gain from walking outside in nature. Those things are important. From getting a hug. This sounds wishy-washy, but they're all important because they turn on the endocannabinoid system. And all you're doing with all these is affecting the endocannabinoid system with external cannabinoids, exocannabinoids, or phytocannabinoids. So remember, it's not just the Band-Aids that we're trying to get, a personal designed Band-Aid for your boo-boo or your symptoms, your ailments, your suffering. But we also want you, when you're dialed in, to make the changes too and change your life so that you don't have to even use these Band-Aids in the near future. I see no problems with CBD. Sometimes I'll take this for my fibromyalgia on a regular basis for the rest of my life. But it depends on my paycheck. So, or the tidings of my patients who drop them off because they don't want them anymore. So I can certainly get rid of them, but because I have fibromyalgia, I would choose to always have CBD 2 to 3 times a day for the rest of my life. If I can do this in a normal form with healthy eating, not too much inflammation, meditative practice, exercise, fasting mimicking diet, but I don't need this stuff. But for the time being, I'm still working on that. I'm still working on me. So I think I'd benefit from it. I know most of my other patients would benefit from it. So hopefully this gave you, sorry for the extra tag on or end credit scene, but I thought that would be very important because I remember saying, some people saying, well, 1 milligram is not that much because I take 10. Well, again, you need this orchestra. It's not just the sound of a French horn or a sound of a drum guy in the back row. It's the sound of the entire orchestra. Sometimes the drum guy doesn't have to beat his drum so loud when the other parts or instruments of the orchestra are working properly. Not just the products, but the other parts of your life, exercise, whole food, mostly plant-based diet, good sleep, and everything else. So hopefully this gives you a little idea. Thumbs up if you like it. Otherwise, I'll see you at the next Minute Clinic.